Do you want, Venkat, do you want to try?
Carry on. Please carry on.
Okay. So, well, first of all, we can thank all for attending this meeting. As Venkat commented, this is a working group on raising fairness in health data and health research performing organizations. And this is the official launch of this working group. This is the first virtual session of this working group, because in previous plenaries we performed different votes, but this is the official launch of this working group. We can start with the presentation of the different chairs of this working group, if you agree. So I give you the floor, Venkat, first, for example.
Okay, thank you. So for those that don't know who I am, I'm Venkat, and I work for the Digital Curation Centre in Edinburgh, the UK. Originally, I'm a biologist, but I was also working in a repository. But then I've moved now into the realm of research data management plans, open research, open science, etc. And in this working group, I'm also part of this Fair for Health project that I mentioned briefly earlier.
Yes. Now, Anu, could you give us a brief presentation about your background, please?
Sure. My name is Anupama Gururaj, but I go by Anu. I am a program officer at the National Institute of Health, NIH, in the Institute NIAID, which focuses on allergy and infectious diseases. But my background, I've had a couple of morphing, I guess. I was originally trained as a biochemist, worked on signaling and nuclear pathways in cancer. And then I got interested in informatics and moved more into the informatics domain, where I was involved in projects that deal with data management, as well as clinical informatics, more in the realm of EHRs and unstructured data analysis. Right now, I am part of the data science group within NIAID, and my interests are in data management, and I do serve as a contract officer representative for a repository that NIAID funds. And this, I'm a relative newcomer as a chair to RDA, but I've been part of RDA for a couple of years now. Thanks.
Great. And now, Christine, it's your turn, please.
Sure. Hello, everyone. I'm Kristen. I am in Canberra, Australia, and it is 4:15 in the morning, so you might have to bear with me throughout this session. As you can tell from my branding above me, I'm from the Australian Research Data Commons, which is a national research infrastructure organisation in Australia, providing support for research data and the research sector in Australia. My background is, prior to joining ARDC this year, I worked for over a decade at what I have to refer to in my role as the research coalface, because a lot of people that I've worked with don't have a direct background working as researchers. Worked for Dementia Research Centre as a data and research manager there, after completing qualifications in psychology and cognitive neuroscience. So a fair background working with researchers, managing data, working on data sharing, and joined ARDC this year and RDA this year. So I'm also a newcomer, but yeah, establishing data sharing for health research in Australia. That's me.
Great. So finally, my name is Celia. I'm a researcher on the Technological Innovation Group at the Virgen del Rocío University Hospital as part of the Andalusia Health Service in Spain. My innovation group carry out different projects with the clinician at the hospital, but now I'm part of the coordination team of the Fair for Health project. That is a project that has received funding from the European Union, Horizon 2020. Well, the main objective of this project of Fair for Health is to encourage the health research community to verify, that is, to apply the FAIR principles, to share and reuse their data set. So if you agree, we can start. We can continue with the presentation. These are the useful links my colleague Kristan put on the chat, the link for the collaborative notes. So please go ahead and enter your name in the list in this document, please. Well, if we go to menti.com and use the code 4250507, we can start with the first question about your background.
May I invite those who said other to maybe unmute and say what they are in terms of other, please?
I can do so.
Yeah. Hi, Rob.
Hi. So I am supporting researchers with FAIR. So.
Okay, sure. Yep.
And I'm doing the same in a support role, but more in the capacity development role to support researchers and policymakers.
Okay, okay. I guess the granularity of what we were asking there, yeah, it kind of crosses, sure. And we have a funder as well. Okay, thank you.
Okay, so we go with the second question. Where are you from? Well, in this moment, we can comment that we submitted the case statement of this working group in Jan 2020 to recite the review of the RDA tab and RDA Council. And finally, this working group was endorsed by the RDA Council in August 2020. So for us, it was a great news to continue with the work initiated in the previous box.
Yeah.
Okay, we have the answers.
Great, okay.
And the last question for now, what is your interest in this working group?
So this is just a free text answer that you can type in, and they'll just appear on screen. We just want to get an idea of what in advance that you might think this working group might achieve. Yeah, okay. Oh, great. So someone doing mental health research, right? Okay. Mm-hmm. Yeah. French RDA node. Great. Invest in strategies or guidelines. Mm-hmm. Okay, I'm glad that there's a lot of background coming from the health research domain, as would be expected, of course, but it's good to see that the representation is here.
Interesting the comments, because the comments about the application of FAIR principles in health research or clinical research data set is important, because we did in this area, we are analyzing the different barriers and the different requirements about technical, ethical barriers of this area.
Mm-hmm.
Okay, so what is the context of this working group? If you want, we can start. Venkat, I can start to comment, and you comment when.
No, please.
Okay, so the context is that we encounter lack of knowledge that in implementing fair data policy in the health research performing organizations, because people maybe need the appropriate skills of the FAIR principles to facilitate the share and reuse of their data sets. So maybe, yeah?
Yeah, if I may add, so even outside of the health research domain, it's quite well known that the FAIR principles are still very much unknown to many researchers. And so if that's the case, even with the health research domain, then making it more integral part of the health research is going to be an added step in terms of difficulty, perhaps, with all the added baggage that it has in terms of privacy issues, etc.
Yes, we need to have the skills necessary to implement a fair data policy to facilitate this share and reuse. Well, this working group searched a global data policy, global guidelines, because maybe there is a disparity in data policies, and we search to share the guidelines in this context. And where we commented that previous both in RDA plenary 13, 14, and 15 about the need of creating guidelines for health research performing organizations to implement these fair data policies. So we are analyzing the results of these both sessions, and we will analyze it in the next slides. And well, the context is that this is a objective of Fair for Health project because this working group has the guarantee of the involvement of this project of Fair for Health. This working group started in the different tasks of Fair for Health. Well, Venkat, what is the objective of this working group?
So yeah, as hopefully you can see here, the main aim is to create a global analysis. So we've already got a landscape analysis, but primarily through the Fair for Health project, it's more at a European level. But now we're wanting to create one that is at a global level, but using similar methodologies, and subsequently to draw on commonalities to provide a set of guidelines that can be adopted by health research performing organizations, or HRPOs, and so that they can increase their levels of fairness in the data that they reuse or generate themselves.
Yes, for that, we expect to have an analysis and in deep of legal and technical, legal, ethical issues about the health research data at the national and international level. Also, the identification of different commonalities and the clear output is to provide to health research performing organization a set of guidelines for implementing this fair data policy. Yes, and what about the timelines?
Yes, so this is a question that is a very open question to you all today, and we welcome feedback on this. But in the case statement that is available to view, these are the different time points, the milestones that we're trying to achieve, and these were actually written a few months ago, and so things have changed. I think definitely in terms of the overall length of the working group, we were originally thinking that maybe we could do it in 1 year, as in 12 months. But I think we've realized that that is probably not the case, and it's more likely to be 18 months. So, with keeping that in mind, what you will see with the timelines written here, these are the original ones with 1 year in mind. I think that is going to be unlikely, but again, regardless of that, we want to know what you think of the feasibilities here. But we'll get to that later. But the first thing that we were wanting to achieve is to create this landscape analysis that's been mentioned. So we already done one at the EU or European level, but we want to take that one step further and try to create one at a global level. So privacy and ethical considerations, as Celia mentioned, and what commonalities are there, etc., that we can create the nucleus around which we can create some guidelines. So the second thing that we want to achieve is to assess the impact of such restrictions in terms of research, as well as financial and societal impacts, drawing on previously mentioned work by Fair for Health, EOSC, and others. So yeah, around the world, there are going to be lots of territorial restrictions, and we don't know enough about those. And so this is why when we were forming this group, we were trying to attract as many people from different parts of the world to find out what the local contexts were. And we're trying to create the network to be able to do that. So the third thing is analysis of a national and international guidelines and policies and their enforcement to compare and contrast and provide a foundation for the working group's own recommendations. So this is an extension to the landscape analysis, really, but providing a bit more granularity to that analysis. And this is extending well into the actual time frame of the working group. So we're thinking maybe from month 3 to month 9, but as I said, this is from the original timeframes that we envisaged. But I guess this would be maybe 1 year into it. But again, we're open to your ideas and suggestions about how long this might take. We appreciate that these are very time-consuming things to be doing. Ultimately, to draft the guidelines and to allow some health research performing organizations that we have identified to test the feasibility of what we're proposing. We can do this through the Fair for Health project, but also I would argue that we need to find ones that are outside of Europe as well, of course. And if you know of any health research performing organizations that would be willing to be guinea pigs for this, then we would be very open to hearing more about them. Next, please. Throughout the timeline of this working group, we need to keep testing what we're doing. And to do that, we need to just provide surveys throughout. And these will be, these need to be designed still, but we are open again to suggestions. If you know of any pre-existing surveys that might be, could be reused, then that would be great as well. But we are thinking about ways to constantly monitor what we are doing. And finally, we want to deliver an output, of course, and that's what this working group is all about. And through the RDA, if we can actually provide some written guidance, that will be the output that can be adopted by the health research performing organization community.
Yes,
and this is sorry.
The work plan. Sorry.
No, please.
No, I said that this is the work plan that you have commented previously. So this is our goal.
And again, I want to stress that 12-month time frame that is illustrated here, that is not set in stone. I think when we wrote the case statement, we were being far too ambitious in what we were thinking. It's more realistic to think that it's going to be probably more like 18 months.
Great. So in this meeting, we are to formalize the launch of this working group. Also, we would like to review a set of principles and steps to guide health research performing organizations to implement this fair data policy. Another relevant objective is to identify these requirements, these important issues, cultural, regional issues, technical and ethical, on adopting these policies in the health research file. So we search a set of steps or recommendations, but internationally valid. And of course, the timelines that Venkat commented to implement a draft of these guidelines in some organizations. As we commented previously, in previous BOPs, we analyzed the necessity of verifying health research data sets because the FAIR principles need to keep in mind some requirements of this type of data. So we got the feedback of the audience of the main requirements of health data. Finally, we got an initial approach of the principles and a set of steps to be included in these policies for fair research data.
This slide just quickly shows, as of the last RDA virtual plenary, so when it was supposedly in Melbourne, this just illustrates the cohort of people that we had attracted from around the world in the Birds of a Feather sessions. So we have pretty good coverage. We want to get more representation from South America, Africa, and Asia, because we want this to be truly a global thing, to try and provide this fair guidelines across the board. So any input in terms of connections or networks that we can feed into, that would be very much appreciated. Thank you.
Can I continue, Venkat?
Yes, sure.
Okay. So, the previous analysis that we have got in the previous BOPs is based on, firstly, on legal and ethical considerations, and also this previous analysis included the analysis performed in Fair for Health project. We consider that health research performing organizations are responsible for performing research under this legal and ethical framework. Fair for Health perform a comprehensive analysis. In this group, we could complemented this analysis with the results of surveys in the previous BOPs. So this analysis includes legal documents, including the General Data Protection Regulation, of course, and also national regulations of the different countries, of the clinical partners that participate in Fair for Health projects, as well as the requirements of each regional ethics committee. An important issue here in this slide is that as open as possible, as close as necessary. So not all open data, especially health research data, are or must be open or free. But these data need to be fair. So other considerations like financial considerations, also the use of a data management plan, because from the point of view of the research funding organizations, the use of a data management plan is a requirement to improve their conditions and to prevent or expect the actions to prevent different barriers of health research data. And finally, well, in the survey about the what do you expect or what is your interest in this working group, some comments were about the skills of researchers in fair policy. So this is a consideration of this working group too. So it's your turn. Please, could you comment more consideration to provide health research performing organizations this a set of recommendations to implement the fair policies? You can go to Menti with the code, with the same code, please.
Yes, hopefully you should be able to see the same screen on your device and be able to type in any answers that you may have. We're getting a lot of information in the chat window as well, of course, so I don't know how much is going to be repeated.
Yeah, just so you know, Venkat and Celia, I've been copying the links and comments from chat into the shared document.
Into the shared document, yeah. Okay, got one thing here, reuse of care data. So I think, I'm not sure whether I mentioned it from the outset. If I didn't, I apologize. And when we're talking about health research data here, that is an all-encompassing term for physical and mental health data, social care data, etc. And yeah, absolutely.
So I have a question about the care data. Is that like data that falls under the care principles, or is that like mental health, or maybe
Ah, I see what you mean. I would invite whoever wrote that to unmute and please clarify.
Yeah, sorry. I meant indeed the data from healthcare to reuse that in research. We're seeing a lot of problems doing that. Data needs to be retyped often, and also in order to guarantee anonymity. So this is a difficulty. Another thing that is related to this is the use of care data from healthcare for research, but also sometimes we're developing some methods in research. People that are currently in care can already benefit from that. So sharing information and also sharing the thoroughness that is needed in care in data that is collected in research is maybe important.
Okay, thank you. Yeah, I agree. So some of the other answers that we've got here, one saying determining how well does the fund understand FAIR principles and their application to health research. And so I guess in a similar sense, another answer here saying sharing experiences. So absolutely a key part of what we're aiming to do is training as well. And of course, that's key to so many aspects of anything that we're doing here. And yes, providing case examples might be a very good way of doing this. Fair advantage for researchers. So incentivization, it can be a big problem, and we need to definitely show the benefits of adoption of FAIR principles, absolutely. Again, this is something that is a very common problem in making data more open as well. And of course, we need to distinguish between fair and open data, but by providing those case examples, I guess, we can at least illustrate the advantages of making the data fair. Any thoughts on this, of course, are more than welcome here.
And also on the aspect of thinking about fair policies flowing from funding agencies to HRPOs, I believe it has started, but I also think that unless there is some, community acceptance, you probably will not see major changes, and that has to happen with the culture change, and that's the hardest part. Even if you have, the funding agencies insisting on fair policies getting implemented.
So
actually, on that, Anna, in Australia, our major funding agency for health research is moving towards more open data sharing policies. Maybe not fair at this stage, but one thing that is an issue that thankfully the funding agency is very mindful of is that they can't mandate policies like that at this stage because there are no actual mechanisms for researchers to implement those policies. And they realize that if they made them a required part of all the projects that they fund, that it would cause real issues for researchers over here, because they'd be creating a policy that can't actually be met at that stage. So I think researchers and organizations themselves need clear options to implement the policies rather than just the policy being created without a pathway to implementation.
Thanks all. And we've got some other interesting comments as well, like should fair policies flow from funding agencies to HRPOs? Open question. And a comment I definitely agree with, that there needs to be, the questions need to be more precise. That health data are not necessarily research data in inverted commas. There may be different legal regulations according to the context. Absolutely, yes. We can't like for like compare health data to any other kind of research data, but we want to at least be able to address as many of the commonalities as possible. It may never be possible to fully verify health research data, but we can. There are different degrees to which it can be done, and so we should at least try and get it as fair as possible. Shall we move on?
Yes, as fair as possible is a good, good conclusion of this discussion. We can continue.
Yeah, we've got more answers coming in there, but
So,
please go ahead.
These next steps were commented in the work plan that Venkat presented previously. So the conclusion is that the final output is these guidelines to be adopted by the health research community. So these steps are the same that the work plan commented previously. And now we can move to the next slide. In this slide, we can see these results about one of the surveys that was performed in RDA Plenary 14. We commented with the audience about the main principles to the health research performing organization, and here we can see the results. And in the next plenary, in plenary 15, we commented with the audience about the key principles. These principles were analyzed in the previous plenary, but in plenary 15, we incorporated some details taking into account the barriers and the requirements that we have commented. So taking into account the previous virtual sessions in plenary 15 and the previous both, and also the analysis performed in Fair for Health, we have this proposal about the main steps of the guidelines. So these steps, we have 10 steps. Well, firstly, the vision and the background that we need to these policies. We have the comprehensive analysis. Secondly, an action plan to put it in this guideline in practice. For example, in this working group, we search, implement this the draft of these guidelines. Training materials for the researchers, identify and describe data infrastructure that will be necessary, and establish a responsible of the organization to implement these policies. Also, determine the agreed level of openness, transparency, and reusability for research data. Also, technical decisions, standards adoption, well, we search to ensure the dissemination of these policies. And finally, create mechanisms for fair data assessment in each organization. But do you think that are these principles, these steps enough to establish these global policies, these global guidelines? Yes, not sure, no?
So yes, you should be able to see the screen and be able to provide an answer.
You can answer, and in the next slide, we can comment your answer.
I guess the point is, it's more of a gut feeling here. Point of this working group is that we're going to be drilling down into the finer details of things, but just from what we initially have, do you feel that this is a good starting point anyway, from where we can go? Okay, well,
yes, not sure.
oh no, I'm glad that there are at least 50% say that it's a good starting point, I guess, yeah.
Okay, so let's comment about these answers. Please add your comments or expand your response.
So, yeah, it is perhaps ambitious, but we're talking about setting a baseline. And so what we're wanting to do is to at least identify the commonalities that exist across different territories. And there are commonalities, we know there are, and to at least bring those into alignment and at least to raise the awareness of those as well, because that will allow the mechanisms to be put in place to share data across those territories, because a lot of the time data doesn't cross the boundaries across a continent. Perhaps it might just stay within Europe or North America or whatever it might be, but that might be because of a lack of understanding of what the regulations might be outside. So yes, it might be ambitious, but we're talking about a baseline level here as well.
Yes, in this line, I would like to comment that in Fair for Health project, we have analyzed the requirements of different European countries. So now we have started with this working group with other chairs. So it's a good idea to search a global policy.
And yeah, it's a comment about international collaborations that's been mentioned. Yes, absolutely. It can foster international collaborations more easily. That'd be a very important thing. So there's also a mention here of the word policy, and I somewhat agree that it can have a loaded meaning there. I don't know if is there any other comments here about that? Should we use the word policy here?
So Kevin, actually, here it was me putting that comment. I'm aware from experience that there's a number of organizations where the notion of a policy has a very formal meaning and lots of formal steps, but you can often achieve the same end by talking about guidelines and principles and practices. That they can achieve the same thing, but they don't have to go through the same degree of formality to get adopted. So sometimes, that just what you call something is important.
Okay, thank you. So what is the strategy for evaluating the implementation and rollout of the policies and protocols, principles and steps as outlined are superb, but will require lots of evaluation? Okay. So the metrics on how these will be tested, is that what is being asked there? May I ask whoever wrote that to unmute? And
hi, that was me. So this is mostly a question about adoption implementation. And this I think aligns a lot with the comments surrounding defining common practices and guidelines as opposed to policies. We can you can kind of see this from the funder space as well of defining policies is certainly great, but then there's both the carrot and the stick issue of how to enforce or align practices in achieving those policies and meeting those requirements. So as you're thinking about those potential adopting 4 to 5 test cases, how would you review kind of the barriers to meeting the requirements within the outlined policies or protocols? And then how to, of course, building education guideline models and adoption guides is superb. And I think that's a great strategy, but then thinking about if they're only able to meet 40 to 50% of the requirements, what does that mean for the comprehensiveness of the policy as outlined? And how do we both demonstrate the real economic benefit and researcher benefit to adopting those practices, and how can that kind of push people to meet those needs as outlined in the policies or guidelines?
Okay, that is an excellent point, and I suppose we need to use existing FAIR metric guides as well. I think that is a discussion point that's very open right now, but I completely see what you mean that, and I guess in terms of economic resources in different areas of the world, yeah, it might not be achievable in many ways. And then there's a sort of unfair advantage and things like that. And we need to address that. That is a big discussion point in itself. And I'm not sure we have the scope to do it right now.
Yeah,
yeah, it's a consideration. Sorry.
No, apologies for interrupting. I totally understand that the question itself is very large. It is trying to think of things to certainly consider and keep in mind as the working group continues. And then also, I think this aligns with the sort of what's good enough versus what's the ideal in meeting those FAIR principles. So I certainly don't want to. That's a very longer discussion, I think. So, but thank you.
Mm-hmm. Thank you. Yeah. Okay. I think in the interest of time, let's keep moving, but thank you for your comments here, because we're keeping track of all these comments, and we'll be documenting these and putting them into the shared document as well. So we can refer back to these at a later point. So Celia, shall we move on?
Yeah. So our last purpose is to be aligned with other RDA working groups, of course, Health Data Interest Group. Another working group related to this group is a blockchain application in health, also for data maturity model. Regarding this working group, I can say that the Fair Data Maturity Model Working Group search a set of metrics to assess the level of fair in data. So this is really interesting to establish synergies with this working group, for example. And the rest of the working group, we can establish collaborations to align our research and our analysis.
If I may also add here, as well as the RDA working groups, there are obviously external organizations and projects and whatever that we need to be aware of and align with too. And I think Anne mentioned in the chat window earlier on, Fair Plus, for instance, which you may or may not know about, but Fair Plus is more in line with the more commercial aspects of verification. And yeah, there are many projects through Fair for Health that we have formed connections with as well, EOSC and others. And so we need to be wary of those and try and form connections there too, as well as the RDA working groups.
And I also want to kind of iterate that, you know, we are not starting from completely from scratch, right? So we are going to see what is being done out, not just in RDA, but also outside of RDA, and then see if we can bring that in terms of the guidelines. And the recent COVID-19 working group definitely has a lot of guidelines and recommendations that has direct implications for this working group.
Absolutely.
Yes, it would be really interesting to establish alliance in that line.
Mm-hmm.
So please, more suggestions for the future and to continue with these working group meetings.
But for the remaining time as well, I would invite people to just give a general idea of the timescales that we have so far outlined and what you might think the feasibility of these things are. And we've already heard some of the comments saying ambitious, and absolutely, I see that too. But we need to be realistic in what we're doing as well, and I welcome any comments regarding this. So the remaining time that we have, this is for open discussion. So if you have any comments on this, please unmute, and the floor is yours.
And also please add your names in the list of attendees. Join us in the on the website of this RDA working group to to be added in our Google group.
I have one question. This is Faisal Fadlalmula. How we are going to get hold of the guideline and principle out there? Because you need to collect them. What is the mechanism? Can you hear me?
Yes, there was a bit of interference, so
Okay.
I didn't quite catch everything.
My question is, what is the mechanism that you are going to collect fair principle and guideline from around the global, and then you have to evaluate and try to incorporate them in the one for RDA. So what is your mechanisms?
Okay.
Because
so,
that will affect the time frame you are asking for. Okay, thank you.
Yeah. So this will involve a lot of qualitative analyses. So in terms of surveys, are going to be at least the initial way of doing this. And it is a networking issue, and RDA is a very obvious organization with its global reach that we're able to do that. And so initially we are going to be using surveys. And of course, by connecting with any international projects or consortia which are dealing with verification, again, this is where we need community input, whether through RDA or other means. We will try and reach out to these the people who are actually implementing these changes. Do you have any suggestions yourself?
I think you answer it, that you make use of the existing network globally and then try to disseminate the survey for a very quick response. Yeah.
Okay.
I guess also hopefully we will have people from different different parts of the world interact with us, so we have a better sense of who should get involved in the surveys, and also from where we may potentially find existing guidelines.
We have one comment on the Mentimeter saying, do you have different focus groups in mind, e.g. researchers, policymakers, etc., that will give you feedback outside of the community as well to see how it would be received by various potential users? No is the initial answer, but I think this is something that we had factored in to happen. But Celia, do you have an answer?
Well, we can say that we have identified these stakeholders for implementing this draft of the guidelines. But a good focus group will be the clinicians, researchers, and technical partners of Fair for Health, and our partners also give us this feedback necessary to expand these guidelines.
And I also want to add maybe repository folks, because they are the ones ultimately, if data comes and is to be distributed through repositories, they will be the gatekeepers in a way, right? To ensure that you actually have verification of the data.
Yeah, absolutely. Yeah, the repository people are key to this as well. Absolutely. I just want to also emphasize as well, and Celia, I completely agree with what you're saying with the clinicians, etc. but I'm very wary also that we want to make this as global as possible. So with Fair for Health, that is a European project, and the purpose of this working group as well is to try and be as global as possible in what we're doing. So we want to try and find the networks to actually truly be able to do that.
Yeah,
Yes.
there is one point here, the experience from Africa, clinicians, they don't respond very quickly because they're busy.
Mm.
So the response time is that not quick. So put that in mind.
All right. Yes. Yes. Okay.
There's also a comment, I think, which is interesting in the chat window, which talks about interacting with patients and their families.
Hmm.
So that comprise charities that fund researchers. So these are also funders, but slightly different kind of funders. So do you want to elaborate, Kevin?
Yeah, so I mean, I'm involved in the project as well, and this is based on experience when PubMed was launched in Europe, and the Wellcome Trust were really good at coordinating lots of these smaller charities in which the funding is often driven by people who are either directly suffering from the disease or have close relatives suffering from the disease. And they're really engaged with understanding, what is their money going for? How is this research progressing? How can that, and they're keen to get an influence over it. And to 10, 15 years ago, the discussions we were involved in were primarily about access to the research literature. So clearly getting open access to it, which is what was behind PubMed, but also a drive then to produce what were called lay summaries. So summaries of often highly technical research papers that could be understood by a non-technical audience. So I think we've got evidence that you've got an engaged community there who clearly will have opinions on this. They're definitely stakeholders, as Celia mentioned. Not easy to engage with unless we can find organizations that pull lots of these charities together. So we're aware of one in the United Kingdom. I think we'd really like to find more examples of that in other countries in the world, because it's difficult for a group like this to have the resources to contact the hundreds, if not thousands, of organizations individually. But if they have representative bodies that we can use to work with them, they could also be great advocates for this, because I think many of them have a real interest in making sure that data that's collected from them and their family is used as effectively as it can possibly be. And that's one of the goals of what we're trying to achieve.
That's a really good point. I'm not sure I know of any organization within the US that really coordinates multiple of these smaller charities, but that's something that we should look into for sure.
So what Kevin speaks of, yeah, and in the UK we do actually have such a thing. So that could certainly be a starting point. But again, this is from a European context, so we want to try and look outward as well. But yes, there are these, there's at least one available here that we could at least find as a test bed, if you want. The other aspect maybe is to think about citizen science as well. And it's a burgeoning field in itself, and I don't know what people think about in terms of this idea of citizen science, whether we should be tapping into that. No?
I wonder, there is an RDA group, right, that focuses on citizen science. I thought I attended a session yesterday.
Okay.
So maybe that could be on our radar as well. just to interface with that group.
Yeah, yeah. And yes, absolutely. And any other RDA groups, whether they're working groups, interest groups, whatever, that anyone feels that we should be engaging with, then please do share your thoughts on that in the shared documents. Okay. So the time is coming to an end in about 5 minutes, but I just want to keep things open just in terms of any outstanding comments that anyone has to make. I thank everyone for joining us today on this first proper opening session for this working group, and really excited to be taking this forward and trying to provide some concrete guidelines that can be adopted, ambitious as it might be, but yeah, we can try and build on what's already existing out there, and the in particular the work that's been done through the project that Celia and I are involved in, then I'm sure it's very much doable.
Yes, I agree. Well, if you like it, we can keep in touch by the mail list. So thank you all for your comments and for attending this virtual meeting.
Yes, thank you everyone. And yeah, you've given us a lot to think about as well in the chat window and through the Mentimeter. So we've got a lot to digest here, and new ways of thinking about what we're doing and how to proceed. So very valuable.
And just some logistics. I wonder if maybe folks are interested in participating in the working group, if it would be useful to figure out right now when we have them on the call, maybe a monthly meeting that we should have to, you know, just touch base, or what kind of you know, communication
well,
they would
also
prefer.
that initially you're all okay with us contacting you as well. I hope that's fine, and we can take it from there in terms of scheduling any meetings. We're thinking it'll be at the very most once a month, maybe every 2 or 3. But it depends on, I guess, at the earlier stages, we may need to do a few more meetings than further into the time of the working group as a whole. But it won't be any more than once a month. Okay.
Okay.
If I don't see any objections, then I'll assume that you're okay with being spammed by us, but okay, fine.
Yeah, that's tacit consent.
Yeah, yeah, exactly. Thanks, Anthony, though. He explicitly said.
Yes, very much consent on this end. Yes. Thank you all for organizing this. This is a superb project. There's a number of different things that align with it across the RDA, so it's great to see.
Thank you.
Very excited. Yeah, thank you.
Okay, we'll draw this to a close, and thank you again for your time. I hope this RDA virtual plenary has been very fruitful for you all, and yeah, let's keep in touch. Thank you.
Thank you.
Thanks.
Thank you all.
Thanks,
everyone.
Bye. Thank you.
Bye.
Bye.